All right, I think we're gonna get kicked off here. Good morning or good afternoon, everyone. Thank you for taking a few minutes out of your day over the lunch hour to come together and see some information about open enrollment this year. There are a fair amount of changes this year to open enrollment, so we wanted to host these events to allow some discussion and some conversation around what those changes are. So I will be going over a couple of the changes that are happening with open enrollment, as well as some resources that individuals can utilize during this open enrollment season to help them understand the changes and the plans that are available to them. And then after that, we will take some time to answer some questions once I'm done with the slides, and we'll do our best to answer those questions to the best of my ability. So my name is Barry Nemeth Jr. I am the Director of Benefits here in UWHR. And regarding open enrollment this year, I suppose the first thing that we should discuss is the change in the dates for open enrollment. So many of us are very familiar with the historical open enrollment period for the month of November. Has been that way for many decades. However, this year, we are changing the open enrollment dates in accordance with the state healthcare authority's mandate that both the PEB and the SEB insurance groups are operating on the same duration for open enrollment. So beginning this year, open enrollment will begin on the last Monday of October, and it will end on the Monday prior to Thanksgiving. What that means for us specifically in 2024 is that open enrollment will start on next Monday, October 28th, and it will run until November 25th, just before Thanksgiving. This allows not only for the PEB program to be in the same cadence as the SEB program, so that's like our K through 12 groups, but it also allows all of open enrollment to be completed before the holidays. So if you look at the calendar this year, if we were on the old cadence, that would mean that open enrollment would end on the Sunday after Thanksgiving, which effectively means that that 4-day weekend that many people get to enjoy would not be something that those working in benefits would get to. So we're looking forward to it this year, that's for sure. It definitely helps us out a little bit. But we definitely want to make sure also that everybody is aware of this time change because, as many of you are probably aware, the Healthcare Authority is very strict on these dates. So everybody must complete their open enrollment by November 25th. The Healthcare Authority does not provide any exceptions to that date. So if things are not completed in Workday and finalized, fully submitted by 11:59 on November 25th, then your open enrollment will not be submitted and you will be defaulted into continuing the medical and dental plans that you already are in, as well as you will be defaulted into the new vision plan, which is the next topic. In addition to those date changes, we are seeing that the Healthcare Authority is separating out vision coverage from our medical coverage. So many of you are probably familiar with your vision plan being, or your vision coverage being a part of your medical plan. And then beginning in January, that will no longer be the case. So during open enrollment this year, we all have to make a vision choice between one of the 3 new vision plans. So those 3 plans are the MetLife Vision Plan, the iMed Vision Plan, and the Davis Vision Plan by MetLife. And those 3 vision choices are fully separate from your medical plan election. I want to make sure that we understand that, specifically around the question of Kaiser medical plans. I know many individuals are used to having their Kaiser medical plan election for their medical and historically have seen a Kaiser eye provider. So in 2025 and forward, that I'm not going to say with 100% certainty because there's probably going to be that one provider out there that's going to just break my rule. But if you are currently seeing a Kaiser eye doctor, in 2024, you will, in almost every circumstance, need to choose a new eye doctor for 2025 that accepts one of the new vision coverages. And the reason for that is Kaiser providers do not accept non-Kaiser insurances. So if you wish to be in network with a eye doctor and have them cover your insurance, you will need to shift if you have been seeing a Kaiser doctor. You could see them if you wish to pay out of pocket, out of network costs, but they would not be in network. Along the plans of those vision plans is that there is no premium. It is very much like dental. So you can cover, well, you have to cover yourself. You cannot waive it, just like dental. You can't waive dental. And you can cover as many eligible dependents as you wish, and there is no premium to cover them either. Additionally, you do not have to make any, you don't have to cover any dependents that you don't want to on your vision. So you can cover under your medical, you can have no dependents. On your vision, you can cover your spouse and your 3 children. And then for your dental coverage, you can cover just your spouse. Those 3 plans can all cover different dependents as you choose what makes the most sense for you and your family. During open enrollment specifically, and I want to make sure that we understand that this is specific to open enrollment, there is a special default for vision. And so while it is the MetLife vision plan that is the default, we also don't want to see a situation where somebody has been covered under your medical plans for the last who knows how many years and has gotten their vision coverage through the medical plan, and then they aren't defaulted into coverage for 2025. So if no choice is made by you and you default into the MetLife Vision Plan during open enrollment, your dependents that are currently covered under 2024 medical insurance will default with you. That way they don't go from having coverage to not having coverage. Now, if you actively go into Workday and you choose a vision plan and you choose not to cover a dependent, that's your choice and you can 100% do that. But for those individuals who do nothing and default into the MetLife Vision Plan, their dependents from the medical coverage will come over. But that is only for open enrollment. For all other events other than this particular open enrollment, default coverage will be that MetLife Vision with employee only after open enrollment. So that's very similar to all other defaults that are employee only for medical and for dental as well. So as I'm sure you've all noticed, we've been trying to do a lot of communication around these very large changes to the plans. So there's been a large amount of emails going out, presentations like this one that are being hosted at different groups. And then additionally, there are the benefits fairs, which are currently happening, actually. There was one on Monday and on Tuesday, and then there is another one today, and tomorrow is the final benefits fair that is on the UW campus on the whole. And so you can go to the UW Medical Center today or tomorrow at the hub. There is also a benefits fair. And I highly recommend that everybody attend those because there are representatives from each of the vision plans there, as well as all of the other medical and dental plans representatives, so that you can ask questions directly to the carriers when it comes to questions of coverage and network, and you can get those answers directly from them. In addition to that, we have on-site resources that we're going to be hosting for a few locations around campus through the open enrollment season. So we will be having benefits representatives and benefits specialists on site at the Facilities Training Center, at Health Sciences, Harborview, and Northwest Hospital. On those particular days, we will have representatives on site for the full day, and they are there to help any walk-ins. So if you are at one of those locations, near one of those locations, and you feel that you need some additional hands-on one-on-one assistance, please do feel free to walk into one of those particular locations, and we'll have somebody there to help you out. We're also going to have some laptops so that individuals can make their elections in Workday if they need to, with a helping hand being there with them. I do want to be clear that benefit staff cannot tell individuals which plan to choose. We can provide resources as to where to find the coverages, where to find in-network providers, but we cannot tell you which one is the best plan for me. We cannot tell you which plans to choose. That is a personal choice that you must make on your own. In addition to these on-site locations, we are also going to be available at Roosevelt Commons East throughout the open enrollment season. This is where our full benefit staff is going to be working out of during open enrollment. So this is just on 11th Street. So if you're familiar with where the UW Tower is, it is just west of the UW Tower on the other side of the parking garages. And we are directly in the lobby there in what used to be the Continuum College space. So if anybody needs assistance and in person, they can walk in there and get some help. Additionally, we are always available online via email at benefits@uw.edu or on the phone at our benefits phone 206-543-4444. And we are happy to set up virtual one-on-ones as well with individuals if they don't feel that they can maybe make it down to Roosevelt Commons East because they may be in a different location. We can always do virtual as well. That is something. We also ask that everybody review the Open Enrollment 2025 information page that we have designed. It has a large number of resources around not just vision, but also the medical plans, the dental plans, remembering that we must choose if you want to participate in an FSA or an LFSA or DCAP in 2025, that you do need to redo those elections every year during open enrollment. They do not carry over year. So all of that information can be found online, or if there are other additional questions, you can reach out to us at Benefits as well. With that is our slide for today. So I imagine that there are a fair number of questions that individuals have, and I'm happy to answer those as we see them.
All right, well, thanks, Barry. We're going to go ahead and just start off right at the top, and we'll keep going and see how many we can get through. So if you hear your question answered, we'll try and probably pass that additional question. So keep your ears open. All right, so the first one is just clarifying. So if you are a Kaiser patient and you've elected to continue your Kaiser coverage, are you saying that they are no longer offering eye care as part of their program?
So for those individuals that choose a Kaiser medical plan, you will no longer see a Kaiser eye doctor for your routine eye exam, your contact lenses, your glasses, your frames, all of that sort of stuff. If it comes to something that is a what I would call a medically necessary eye issue, I'm thinking like eye surgery, something along those lines. That is covered not under your vision coverage, but under your medical coverage. And so that would be something that could be covered under a Kaiser physician. But things such as going for your annual eye exam, contact lenses, that sort of thing would not be under your Kaiser coverage, because that's medical coverage, not vision coverage.
All right, thank you. Next question is on premiums for dependents. Are there premiums for dependents with dental coverage?
No, neither dental nor vision have any premiums associated with them, regardless of the number of dependents you do or do not cover.
All righty. And so along those lines, when dependents age out of coverage, does a monthly premium decrease? And if so, for which types of coverage?
So that's going to be a very particular question. So there's no charge for premiums regardless for dental and for vision. If you're discussing medical coverage, potentially it's going to fully depend upon the number of dependents and the types of dependents that you have. So there is a there's a different rate depending on if you're covering a yourself only, yourself plus spouse, yourself plus only children, or your full family. So it's going to fully depend upon who your other dependents are if there is a premium change for you.
Great, thank you. Next question is had quite a few upvotes. Is MetLife a VSP insurance?
No. I see this question a lot. So VSP is a contracted third party who is helping out MetLife to do some administrative tasks. It is not a VSP insurance. It is a MetLife insurance. And they are just using the third party VSP to do some administrative tasks for them. This has caused a fair amount of questions in the last couple of weeks because depending on where you go, you may see on the MetLife website itself this called the MetLife Vision Plan, also being called the MetLife VSP. They are synonymous, but it is not a VSP administered, set up VSP network plan. It is a MetLife plan.
All right, thank you for that
Yeah.
distinction. Next question is, which, if any, of the vision plans cover you nationwide?
You would have to go and actually look at each of the plans to see what their network is. Each one is going to have their own specific coverages in different areas. And if you have specific locations that you need to ensure that you have coverage in, the best thing to do would be to go to the plan directly and speak with them to see if they have coverage in a specific location that you need coverage.
All right. So the next question is around waiving coverage. So if you are covered for your medical or your dental by your partner's insurance and you've waived that at the university, is that the same now for vision, specifically in scenarios? This one is one member is SEB, the other is PEB, and so dual coverage isn't
Yeah,
possible.
for those PEB and SEB dual coverage scenarios, there are very particular rules around those where there may be the availability to waive dental and vision coverage, which are typically non-waivable. In those particular scenarios, though, we would ask that you work directly with our benefits staff to more accurately understand your particular individual situation. So I would recommend reaching out to us directly at benefits. We do work with the healthcare authority to identify those people who fall into these dual enrollment situations so that we can coordinate across the two PEB and SEB plans.
It's great. A few questions around who do we reach out to? What's the contact information? If you just have follow-ups, if you're on Bothell or Tacoma and can't attend a drop-in, if you're remote or out of state.
Yeah, if you are not at one of those drop-ins or you can't make it to Roosevelt Commons East, I do recommend that you reach out to us at the benefits@uw.edu email address, and we can set about setting up a one-on-one virtually through Zoom or Teams to meet with you. Or we can communicate through email that way as well if that works for you.
Great, thank you.
Mhm.
The next question is how do you research which plan your doctor might be covered by, specifically with vision?
Yeah, with those, the easiest thing to do is to go directly to we have links to these on the benefits open enrollment page, is to go directly to the provider search at each of the three plans and search for the provider that you wish to continue coverage with. And if they are in network, they will appear on that particular find a provider search tool. You can also contact your provider directly and let them know the three plans and ask them if they work with MetLife Vision, iMed, or the Davis plan. With the caveat there, as we talked about with the VSP thing, is that some people do name the MetLife Vision Plan the VSP MetLife Vision Plan. So just do keep that in mind. But the easiest thing, honestly, that we've found is just searching online through the Find a Provider search tool.
All right, thank you.
Mm,
Next question is, where is the facilities training center? I'm happy to speak to that too.
Go ahead. I actually do not
Yeah.
know its explicit direct location. So
Yeah, that location it's right on kind of the edge of campus, right across from U Village. It's that really long building. That's where there's a lot of where UW Surplus is. That's also where U cars get serviced if you've ever been over there. And the training center is you enter a main door right there, right off. Can't think of the name of the street, but directly across from U Village onto campus.
oh, I'm glad to know. I'm not the one going to that particular location, but I can help my staff get there now.
And Lisa, I'm sure it does pop up if you put it into a map search as well, which is helpful. Okay. Someone asks for Roosevelt Commons. Did you say we just walk in or do we set up a meeting?
You can just walk in. It may be easier to set up a meeting because if there are a large number of people and you're walking in, we are going to work on a first who is scheduled a meeting first basis and then a first come first serve. So if there are a large number of people, you may have a duration to wait before somebody can assist you. So if you have a particular time frame that you have to maybe squeeze in your questions, I would recommend emailing us and setting up a specific time to come in.
Okay, so the next one says the coverage for frames and lenses are renewed every January of odd years.
Correct.
Um, Not use the service. Okay, so the way I'm interpreting this is that it's because we're switching plans and it's a new, vision provider. If you used the service this year, are you familiar? Can we use it next year?
Well, if you're using anything
Or,
this year, that is not going to be under any of these three particular plans because these plans are not currently in effect for 2024. So any services that you use in 2024 are going to have no impact on the new plans in 2025. So it is correct that under all three of the new plans, they provide their services on every odd year. So 2025, 2027, 29, etc. So if you did need to get some sort of coverage this year for lenses or frames, um, if you can squeeze it in before January, do it. And then then you'll have something also in 2025 under the new plans.
great. I believe you already kind of talked in detail about the VSP distinctions. So got quite a few folks who had that same question. This is another one. Who can speak to the significant increase to the premium for the UW physician option for regents?
I'm not sure what that is exactly referring to. All premiums are set by the state healthcare authority and the Public Employees Benefits Board. So any questions about specific plan coverages and premiums are best addressed to the state. They are not negotiated or set by the university in any way. We are not involved in that process, nor are we consulted on those changes.
All right, moving along. Will the medical plan premiums be changing because vision has been taken out?
Again, that is a question best asked to the state since we are not involved in setting the premiums.
And then again, talking a little bit about dependents, can you add a spouse to your vision if they're not covered under medical?
Yes, as long as they are a qualifying eligible dependent. So that is spouse, state registered domestic partner, um, children, be them adopted or stepchildren, and a few other options in there as well. Then they can be added, and you do not have to cover the same dependents on any three of the particular main insurances that we have. What I will say though is that if you do waive medical coverage for yourself, then you cannot add dependents, or you cannot add dependents to medical without you.
Okay, we'll just stick with kind of some of these dependent questions.
Mhm.
So one is if your dependent has aged out, and maybe we share what that age is, can you still elect to cover them on vision and dental?
The age out is at age 26, and if somebody is aged 26 or older, they cannot be covered under medical, dental, or vision. They are no longer an eligible dependent at that age.
Okay, and then similarly, who are qualifying dependents? For example, can they be parents?
Typically, no. Um, and you can find all of the qualifying dependents on our website. There, on our open enrollments page for 2025, there is a list of all of the individuals who can be considered a eligible dependent, but in almost all cases, no with the parents.
All right, and I'm just going to quickly share. I see you're still here. I see your comment about being just some back and forth with providers. I think that might be something maybe to reach out directly about to work through. Moving forward, we had a follow-up question for coverage for contact lenses. Are you able to speak to what that is?
Each plan is going to have a different coverage level, and so you are best to review each of the three plans directly to see what their coverages are. I will note that with the iMed coverages, is a different coverage sheet for those individuals that are over 19 years old and for those that are under 19 years old. So if you're talking about contact lenses for a minor versus an adult, those are going to be different coverages. So reviewing those directly with the providers is going to be the best bet.
All right, thank you. And then you did speak to this earlier, but just a follow-up, confirming. So these vision plans typically only cover routine eye care. If you have eye care beyond that, can you just speak again to where you get your coverage for that?
Yeah, routine eye care is going to be through your vision benefit. Anything that is beyond routine eye care and falls into the medical category, so things such as eye surgery, such as cataracts, detached retina, those sorts of things would fall under your medical insurance because they are no longer routine, they are medical procedures at that point. And so those would fall under your medical insurance, whichever plan that is that you choose.
And are you
Um,
able to speak at all to how that will work for Kaiser patients with kind of referring that information back into Kaiser?
if you have a particular procedure that is surgical in nature and you need to have surgery on your eyes, you can work directly with a Kaiser. If you have Kaiser insurance, work with Kaiser directly to schedule that and ensure that all of the procedures that you need to have taken care of are covered under that particular one. So it is a coordination with the individual who's going to be doing the surgery for you and making sure that they understand both that you have Kaiser coverage for medical and what your vision insurance is, which is outside of, and they can help you do a coordination of benefits in those particular issues. So that's something that is between yourself, the insurance companies in this case, plural, as well as the providers that are helping you.
All right, thank you. I do just want to do a quick time check, recognize we are at 12:30, which was, the scheduled time for this session. Barry, do you want to continue answering questions? Shall we do maybe a sum up sheet or?
I have about 5 minutes that I
Right.
can continue asking questions for,
I know
and
lots
then
of
if yeah, after that, I think I'll try to do my best to answer any questions afterwards as a summary.
lots of good questions. And I do know that if you are able to attend either the virtual fair or the on-site fairs this week, there's a lot of great information there. And the Healthcare Authority usually brings about 5 folks to their table who can spend some good time with you as well.
And I can attest from some of our benefit staff that the vision tables have been the most popular tables by far so far over the last 2 days.
Another question is, can you speak to Walmart, Sam's Club, Costco credit and just what that is for vision plans?
Um, not sure exactly what the question is, but if the question is if they are in network or not, the best way to figure that out would be to work with the Find a Provider tool to understand if those particular locations are in network or not.
Okay.
Any coverage any questions about if a particular provider is in network for any of the three new plans are best directed directly to the plans through their Find a Provider tools. We found those to be much more robust and easier to navigate than um, than calling those particular providers. It's also much quicker as what we found as well as the online tools.
Right. Sounds good. I'm just doing a quick scan through to see if there's any major glaring questions we haven't spoken to. Are you able to speak to at all which of the options is closest in coverage to current vision?
Well, I can't because there are multiple vision this year, depending on which medical plan you are
Like
particularly
typically
in.
for UMP?
Coverage questions are best directed to the carriers in particular. So it would be best to pull up what your current coverage is for your current medical plan vision coverage in 2024 and do a side-by-side comparison. It is also something that you can do online through the Healthcare Authority, and I can make sure that that link is on our open enrollment page. They have an online compare tool that you can use through the Healthcare Authority for vision as well to compare the three different plans side by side for the same procedures, where you can see what the copay or coinsurance is going to be.
All right. I think to close this out, I'm going to just quickly read. There's a few questions here about the Smart Health incentive. Can you speak to, the $125 incentive for completing your Smart Health points goal? How does that get applied to either your deductible or your HSA?
Yeah, so if you participate in the Smart Health assessment and then collect the required number of points for example, in this 2024 year, if you hit that particular mark in 2024 by the deadline, then Smart Health will, depending on which plan you choose during open enrollment, they will at the end of January 2025, they will either apply a reduction in your deductible for your medical plan that you've chosen in 2025, or if that medical plan that you chose is a high deductible plan, they will deposit $125 into your HSA also at the end of January in 2025. So there is no after you reach the particular threshold of a Smart Health and you've received that confirmation in their portal that you have hit the required, I think it's 2,000 points, if I recall correctly. If you've hit that 2,000 point threshold, there's no additional steps required by you at that point in time. And then late January, very early February, you will either see when you log into your medical portal, you will see a reduction in your overall deductible for the plan. Or if you are one of the individuals who participates in a high deductible plan with an HSA, you will see that $125 deposit come in right around January 31st, give or take a couple of days for processing.
All right, thank you. I
Mhm.
know we've got lots of great questions in the chat, a lot of questions about plan specifics, what's covered, what's not, and where to find that coverage. So we'll definitely be sure to share some resources on where you can find all this information. Just thank you for all your time. Thank you, Barry. We appreciate you helping us navigate all these changes.
No problem at all. And I hope you all have a very good rest of your week and open enrollment season. I highly recommend for many of these questions reaching out to or reviewing our open enrollment page, which has resources to each of the plans, including their certificate of coverage, which can be great resources as you're making your decisions. Thank
All
you all.
right.